It's truly exciting to be here and to talk about one of my favorite topics, which is infodemiology. And that is a term that's in everybody's vocabulary now, and in the context of the COVID pandemic, of course. But I have actually been using this term for over 2 decades, and I'm also credited with inventing the term infodemiology. So in this presentation, I will share a little bit my journey and a couple of insights, and also the relationship of infodemiology to what I'm doing right now in my capacity as a publisher. Because in a sense, academic publishing is also a filtering process where we decide what is trustworthy information, what's not trustworthy. This is what academic publishing and peer review is all about. And being the founder and CEO of JMIR Publications, that is also my line of business. So that's why in my LinkedIn profile, which is shown in this slide, there's my job titles are CEO of JMIR Publications, but also infodemiologist, and that is something I've had on my LinkedIn profile for 2 decades now. So to wake everybody up, I know it's a Saturday morning, at least in my books this morning, it's noon, but it is Saturday morning, and I know it's a young audience, so I'm gonna start with a provocative question here to wake everybody up. What does health information, specifically on the internet, have to do with R-rated movies? So give you 5 seconds to think about it. One of the answers here is that it can be and perhaps should be rated or labeled. So in movies, we are rating with a certain rating scheme. There are third-party providers who offer this kind of rating with information, health information, but these days really also other kinds of information. We have that concept of fact-checking, labeling, self-disclosure, and so on. So why am I asking this question? So because it has to do with my personal journey, and I had this idea already in the mid-90s when the World Wide Web emerged. There was a lot of discussion on what should we do with health information? Should this be regulated? Should we just, how do we make sure that the public is not harmed by low quality health information? So I came across this technical standard, which was originally developed to rate pornographic websites and explicit images and so on. So this is an infrastructure based on RDF, XML, that allows providers of information to self-rate themselves, but also third parties to rate another website or another web page or another piece of information like an image. So I thought, okay, this is an interesting infrastructure, and perhaps we can and should use this for health information as well. So I created this project in the mid-90s, which was based on this standard, which is called PICS, Platform for Internet Content Selection. And I had this ambitious goal, and that goal was actually funded by the European Union as a pilot test, to rate information, start rating information of health information on the internet, together with a lot of partners. And so that's what I set out to do. So back then there were a lot of institutions already out there which rated health information, and I thought, okay, let's give them a standard on how they can describe health information in a machine processable way, and let's put that into kind of an open database, and let's aggregate all this information. Now this proposal was published in the British Medical Journal, the BMJ. It was accompanied by an editorial that also speaks about information epidemics. So this is kind of one of the roots of that term, infodemiology. So this was basically we proposed a kind of an immune system against low quality information. But the editorial was rightfully quite critical about this. We really know so little about the impact of information and how it's distributed and so on. So that was one of the origins of this term. So that project, by the way, was not really successful. It did not take off because first of all, it was predicated on the idea that health information providers self-describe the information with structured metadata, for example, XML elements. And there was no or little incentive for health information providers to do so. And it's also a marketing problem, of course. And people don't know about this, they won't do it. But then there were also other like third-party rating services out there. And for them, there was really no business model to share those rating data in a kind of an open directory, because their business model is on that they, for example, offer the rating data on their website or offer subscription. So there needs to be a business model to feed those data into kind of an open directory. Without business model, this would not succeed, and it did not succeed. And then the third problem, of course, was this vast amount of information out there, all these websites and web pages. And today it's even more with social media, with all those micro publications like tweets and so on. So there's just a myriad of information out there, and nobody can keep up with that. So that whole idea of rating elements of information is perhaps cannot be done without, at least not without support from computers. So I think these days, again, we should have another look at some of these ideas, because artificial intelligence, natural language processing, sentiment analysis, these are all tools which can help in this battle. And perhaps we cannot rely on humans to tag or label information. Perhaps we need machine support for that. And the fourth problem was obviously also there's no good definition on what quality actually means. And but perhaps that is also one of the strengths of this kind of a decentralized labeling project. So to get a better handle on what are people actually saying when they speak about quality health information, we did a systematic review. So we looked at all the studies that were published up to the year 2002 when this systematic review was published. So I looked at all the studies. It was at the time like almost 100 studies where authors systematically searched information about a certain topic on the internet, and they rated the quality of the website or web page. So I wanted to create a framework based on what people have done in evaluating health information. So we studied this, we published this paper, and basically the quality criteria that were used here could be broken down into like three types of quality criteria. One is quality criteria of the source. So that goes to the idea of source credibility. So if there's some sources are just more trusted than other sources, government versus private corporations, for example. Then there are content criteria. It's basically accuracy and completeness are the major sub-quality criteria here. And then there are technical criteria, for example, and that has to do with disclosure, for example, privacy policies, what is an editorial policy. So all this disclosure information on how is information actually produced and presented, and what kind of quality checks are made at the source. And also, for example, things like dates. When was the information posted? When was it last updated? When was it last reviewed? So these are all quality criteria you can extract. And then it occurred to me, boy, this is a real new science here. And how are these quality criteria related to each other? How can we develop algorithms or models, perhaps multivariate models, to determine what is good health information and to guide consumers to the best health information out there. But another problem also became evident, and that is that in medicine, the truth is often an elusive concept. And for example, if you look at diet information, what is the best diet to lose weight. So there are very different schools of thought, and the evidence seems to be constantly changing. So especially in medicine, there's often no ground truth, or the ground truth is just really hard to determine. So, and that also led me to think that, infodemiology is not only about misinformation. We should be a little more neutral when we assess information, and we just say, okay, this is one point of view, there's another point of view, and how far are those points of view you can find on the internet? How far are they removed from what's the best clinical evidence, for example? So we actually, when we measure the quality of health information, at least when we look at the content quality and look at the accuracy, we really measure the distance between what's written in clinical guidelines, or what do systematic reviews, for example, the Cochrane collaboration, say about a certain treatment or condition. How far is that removed from or different from what people are saying on the internet? So that's one possible view on how you can measure misinformation, towards the gap. But you can also do more qualitative analysis and ask questions like, why is there dissonance? Why is this not the same as the ground truth? So it goes beyond studying misinformation. The user-generated big data on the internet reflect knowledge, behavior, attitudes of people. Knowledge, behavior, attitudes have a public health impact. If you measure that, you can perhaps make certain predictions. And one prominent example, I'm going to skip this. One prominent example is what you can learn by simply looking at what people are searching for on the internet. So today, this is known as Google Flu Trends. We did a precursor study 3 years before Google launched Google Flu Trends. And this study actually inspired Google Flu Trends because we were the first who showed that there is a correlation between people searching for influenza-related terms on the internet and an actual influenza outbreak. So that is just a demonstration of how signals, infodemiology signals on the internet can be useful for public health purposes. So that was done 15 years ago. So when talking about sources on the internet, which we can analyze, we can also broadly distinguish between demand-based infodemiology metrics, which you can obtain by studying what people are searching for example, on the internet, or also what kind of questions they ask in tweets. And then there are supply-based metrics. So what are people actually publishing on the internet? And you can monitor this over time. You can determine trends. You can determine predictors. And that is really what we refer to when we say infodemiology. In 2009, I published another framework where I also introduced that concept of infovalence, which means a longitudinal measurement of what people are posting. Today, that's also referred to as social listening, and many like non-health brands and companies and product managers use this to monitor, for example, how the crowd on social media is thinking about their products or services over time. We did this already in the last pandemic, and many may have forgotten that we had another pandemic before. In 2000, in the early 2000s, there was the H1N1 pandemic. That was around 2009. And so we monitored Twitter. So we built the first, what we call infovalence platform. Today, also infovalence is basically very similar to social listening. So an infovalence platform would take social media mentionings of certain topics and analyze it over time. So, and we did this in the H1N1 outbreak. We were measuring over time what people were tweeting about. We were also trying to break down like what's the prevalence of misinformation, which I think at the time it was around 5% misinformation in tweets. We also could just monitor this use of terminology. If you may remember, H1N1 was first known as swine flu, but that didn't make the pig farmers happy. So there was an active lobbying process of just changing the terminology from swine flu to H1N1, and that was also supported by the WHO. And we were just measuring over time how that terminology changed over time, and also how certain media reports influenced it. And there was a social media campaign by pig farmers, and you could actually see how that spike in retweeting that that marketing campaign changed the terminology, or helped to change the terminology by a dip in the use of the term swine flu. There were some other attempts to get that problem resolved of trustworthy information, and the WHO was actually lobbying for a while to use the .health top-level domain for trustworthy health information. That was a proposal that ultimately failed. And yeah, so these days, everybody is talking about misinformation on the internet again, although the WHO is defining an infodemic as an overabundance of information. Some is correct and some is not correct. In my mind, this is a very blurry and fuzzy definition that is not very scientific, in the sense that overabundance is not something you can measure. What does overabundance mean? When does it end? When does it start? So, but as scientists, we're trying to bring a little bit of order into the chaos by publishing infodemiology studies. And if you go to our JMIR website, you will see we have published some e-collections on that topic with almost 500 articles now. And not stopping there, we actually also created a new journal, JMIR Infodemiology, because we really think this is a new discipline, and how to manage infodemics, but also how to describe health information, how to measure it, how to measure trends over time, what role does NLP and artificial intelligence play here, and so on. And it's also very related to what we do as a publisher. So as a publisher, our mission as an academic publisher, our mission is to publish trustworthy medical research. And how is trustworthy medical research defined? It's defined as something that where peers, when they look at it, so other people with a similar background, they find this paper publishable or interesting. So when we peer review a paper for publication, a paper goes through 1, 2, 3 experts who read the paper and to say, yes, this needs to be changed to make it publishable, or no, it's completely invalid, do not publish this paper, or they say, yes, this can be published as is. So, and science has also evolved a lot, especially fueled by the coronavirus crisis. So science communication has changed in a sense that peer review used to be really a prerequisite to get information out there. So back in the last century, when journals were the main medium to get scientific information out, printed journals were really the gatekeeper for trusted information. Now we have the internet, we have things that, for example, preprint servers, where scientists actually deposit work in progress that is not peer reviewed yet. And that has helped tremendously during COVID to get information out very quickly. But the drawback is, of course, this information is not peer-reviewed. So as a publisher, we are also trying to assess we try to play with new models of science communication. So one way here would be to offer a rapid peer review of preprints and then publish those preprints in what's called an overlay journal. So we have prototyped a overlay journal. We are actually the first publisher with a PubMed indexed overlay journal. PubMed is the main database for scientific publications. We are doing an overlay peer review. And to close the loop to what I said in the beginning about health information on the internet. So again, we have new possibilities here to peer review information and to move away from this expert-based peer review, which is this slide shown on the lower right, to a more distributed review approach where we perhaps aggregate and collect information from different sites, from different opinions, from social media, from the commenting page of the preprint and so on. So that is, for example, something that might be interesting to play with. And this is kind of our R&D work at the moment. And it is related to infodemiology because we have similar approaches in mind when assessing health information in a decentralized manner.